Hey everyone! Welcome back to our channel today. We're diving into a topic that many new parents have questions about, but might feel a bit shy to ask. We're talking about sex after pregnancy. Whether you're a new mom, dad, or just curious, this video is for you. So let's get into it. Let's talk about the emotional side of things. Pregnancy and childbirth bring about a whirlwind of emotions. You've just welcomed a new life into the world, and that's a huge deal. But with that joy, there might also be feelings of anxiety, fatigue, and sometimes even a bit of disconnect in your relationship. And guess what? That's completely normal. For many, the first few weeks, or even months, after giving birth can feel like an emotional roller coaster. Hormones are adjusting, sleep is scarce, and your focus is entirely on the baby. It's important to acknowledge these feelings and have open conversations with your partner. Communication is key to navigating this new phase together. Now, let's discuss the physical changes that occur after pregnancy. Your body has just gone through an incredible transformation, and it needs time to heal. The uterus, which expanded to accommodate the baby, takes about 6-8 weeks to return to its pre-pregnancy size. During this time, it's normal to experience bleeding, known as lochia, which can last up to 6 weeks. For those who had a vaginal delivery, there might be soreness, especially if there were tears or an episiotomy. If you had a C-section, the recovery might take a bit longer due to the surgical incision. Regardless of the type of delivery, your body needs time to heal, and it's crucial to listen to your body during this period. A common question new parents have is, when is it safe to have sex again? The general recommendation is to wait at least 6 weeks postpartum, but this can vary depending on individual circumstances. Always check in with your healthcare provider before resuming sexual activity to ensure that your body is healing properly. It's not just about physical readiness. Emotional and mental readiness play a huge role too. Don't rush into it if you're not feeling up to it. There's no right or wrong timeline. What's most important is that both partners feel comfortable and ready. Let's talk about some of the common concerns many new parents have when it comes to sex after pregnancy. Will sex feel different after giving birth? The answer is, it might. After childbirth, the vaginal tissues are often more sensitive and might feel different during intercourse. Hormonal changes can also lead to vaginal dryness, especially if you're breastfeeding, which might make sex uncomfortable. Using a water-based lubricant can help. It's also important to go slow and communicate with your partner about what feels good or if something doesn't. Another common concern is about libido. It's not unusual for new moms to experience a decrease in libido after childbirth. This can be due to hormonal shifts, fatigue, and the demands of caring for a newborn. It's important to remember that this is normal and usually temporary. Focus on intimacy rather than just sex. Small gestures of affection can go a long way in maintaining your connection with your partner. Speaking of intimacy, it's crucial to remember that it's not just about sex. Intimacy is about closeness, trust, and love. Simple acts like holding hands, cuddling, or having an uninterrupted conversation can help rebuild that connection. Take time to rediscover each other. Schedule date nights, even if it's just a movie at home after the baby is asleep. Communication is key. Talk openly about how you're feeling, both physically and emotionally. If either of you is struggling, don't hesitate to seek support, whether it's from each other or a professional. Here are some tips for maintaining a healthy sex life after pregnancy. Take your time. There's no rush. Take things slow and go at a pace that feels comfortable for both of you. Use lubrication. Hormonal changes can cause dryness, so don't hesitate to use a lubricant to make things more comfortable. Focus on foreplay. Spend more time on foreplay to help ease back into sex. It can make the experience more enjoyable and less painful. Communicate openly. Talk to your partner about what feels good and what doesn't. It's okay to set boundaries. Seek help if needed. If you're experiencing pain or discomfort that doesn't go away, talk to your healthcare provider. There might be underlying issues that need to be addressed. Be patient. Understand that it might take time for things to return to normal. Be patient with yourself and your partner. If you found this video helpful, don't forget to give it a thumbs up. Subscribe to our channel for more content.